Alrighty, so this particular webinar is very much going to be within the context of dealing with change within the current sort of COVID-19 sort of evolving sort of situation, and how we kind of deal with the stress associated with returning back to work. So with this global pandemic, many of us would have experienced sort of significant changes that we wouldn't have had to sort of embark on prior to the pandemic, obviously. So following some really sort of strict protocols, adjusting to working from home, and changing our all too familiar routines. But now with the development of the COVID-19 vaccine, for instance, the increasing containment of the virus, or we do have a couple of cases here in New South Wales at the moment, so in the community, but nevertheless, with the increased immunisation of the population, but only partial immunisation, we found that we're increasingly sort of being asked to return back to work. So now many of us might find ourselves, for instance, concerned about returning back to the workplace, and this may manifest itself in the form of stress particularly sort of in the form of actual sort of burnout, right? So what is burnout? So burnout is very much a combination of emotional exhaustion, so feeling demotivated, is loss of energy, and that concept of demotivation is quite important, wearing out, and a sense of feeling depleted and fatigued. We also might find that we're starting to feel really sort of irritable, so this desire to withdraw from others and having negative attitudes to other workers and staff members, feeling dissatisfied with personal accomplishments, this reduced productivity, reduced sense of capability, reduced sense of morale, inability to cope with stresses, and then a lot of negative self and job related evaluation, and a lack of expected reward and recognition on the job. And burnout is very much, stress very much is caused by burnout. So stress causes burnout essentially. Now, within this particular sort of context, what are we sort of stressed about? So it's usually around, feeling tired as a result of actually sort of being cautious, or not feeling like you're able to engage in those normal sort of social interactions, especially sort of now. I just heard that have been sort of new restrictions that have been implemented for the next 3 days, for instance, or, feeling uncertain and anxious about employment, or worrying about what the world is actually going to look like post-COVID. It might also, be associated with the unpredictability of lockdown. So we had lockdown in Western Australia, for instance, lockdown in Queensland just before Easter and a couple of months ago in Victoria, and all of that is being interspersed, so between working from home and that home work sort of movement, right? So what are some common worries that can sort of underlie some of this burnout and some of the stress that we're experiencing? So some of these worries might be, so how COVID safe is my workplace going to be when I do transition back to work? How compliant, how COVID safe are the policies and the procedures and the environment going to be? So what if I'm feeling anxious about going back to work? I've spent the entire year being extra cautious. Now I have to go back in. I'm not feeling like I'm capable of doing that. So how can I and my household adjust to the new day-to-day routine and the drudge yet again? So what if I'm scared of catching COVID-19 on my transition, so to and from work? And how do I deal with colleagues who more or less may be less or more concerned about COVID than I actually am? Now, I think it's sort of really important to reassure ourselves that within this particular context, it's going to be quite normal for us to actually sort of experience anxiety. And the focus of this webinar is very much just to look at some practical skills and tools that we can use to help us smooth that transition, so back into the workplace, to make it as smooth as possible. Now, what's the first thing that we want to talk about when talking about reducing or mitigating burnout within this evolving sort of situation? The first thing that we want to talk about is resilience building. So what is resilience first and foremost? So resilience is this ability to adapt well in the face of stress, anxiety, hardships, and challenges. So it refers to this ability to be able to bounce back quickly after stressful situations and to be able to adapt flexibly to new situations. And it's this resilience that is what we consider to be a personal strength that contributes to positive development, optimal sort of functioning, and it prevents negative emotions, thoughts, and behaviours. Now, resilience can reduce the effect of stress on burnout, and it reduces the impact of the severity of COVID-19 related perceived risk and fear and stress and anxiety and depression. Okay, so COVID-19 stress, it directly impacts resilience, and COVID-19 stress directly impacts burnout. The idea is that we want to improve our resilience in order to reduce the levels of burnout that we're experiencing. So how do we do that? How do we resilience build? So one of the ways in which we go about that is to firstly identify areas within our lives that are of personal value. Then what we want to do is identify activities that we can do that are aligned with those areas in our life that are of personal value. Okay. So when we engage in activities that are in line with areas in our life that are of personal value, that's when we start to feel like we're living our lives meaningfully and with purpose. And when we feel like we're living our lives meaningfully and with purpose, that can reduce our levels of stress and our overall levels of burnout. Okay. So how do we do this? We identify areas in our life that are important to us. So that might be service to others, family and friendship relationships, hobbies, mind, body health, spirituality, our job, our career, our extracurricular sort of study. Then we identify and we take a pen and a piece of paper and we write down the activities that are in line with one or more of these areas that are considered to be important. So it might be our hobbies. So activities that might be in line with our personal values and that are important to us that fall under hobbies might be something like gardening, pottering around the garden. Adult colouring might sound a bit facetious, but that sort of concentrated activity can actually help reduce stress. Drawing, painting, pottery and ceramic classes, French cooking, photography, learning a new recipe, exploring local areas to travel to, for instance. It might be exploring areas within your neighbourhood, going down new areas that you haven't visited, the beach, for instance, or the national park, creative writing, novel writing, whatever it is. And you take that list and then you implement that list within a timetable. So you engage in some activity sort of scheduling. Now, it might be, say, for instance, that you're working from home Monday and Tuesday, right? On the days that you're working from home, what you want to do is you actually want to implement a strict schedule, okay? So on the Monday and Tuesday. And the reason why that you want to do that is because one of the things that makes it difficult to actually sort of transition from home back into work is when there's a lack of structure. So you keep working from home because there's essentially sort of no separation. So what you want to do is create that structure in your day on the days that you're working from home. That's clearly demarcate home and work life. So on Monday, it might be, okay, so 9 to 12, I'm actually going to be working. Then from 12 to 12:30, I might do some household chores. And that's important because you actually want to be limiting distractions, because when you're at home, you can easily become distracted by doing tasks such as household chores. So you want to schedule set times where you can take a break from work to complete these tasks rather than completing them randomly throughout the day. Then what you want to actually sort of do is, that 12:30 break, and then from 1:30 or 12:30 to 1:30, for instance, you want to sort of go and eat something. And that might be at home, in the kitchen, in the dining room, away from your dedicated workspace. And that dedicated workspace might be, where you're working needs to be a place away from noise, good lighting, good seating, you're comfortable, for instance. But then when you're eating, you need to separate yourself from that sort of workplace to get out to create that separation. And then from 12:30 or 1:30 to 5, you want to return back to work. 5 o'clock, you want to sort of take a 1 hour break, sort of perhaps where you're actually sort of mimicking the traveling home process. So you might be going for a walk or going for a jog, but leaving the actual sort of house. Okay. So that helps to that sort of strict sort of schedule sort of helps to create that boundary between home and work life, and also to mitigate against burnout. Now, also remembering that on the days in which you actually sort of have to go to work, so on the Wednesday or the Thursday or the Friday, for instance, you might realize that, hey, instead of sleeping in or going to the gym, doing those activities that I value, that are of personal value, so the gym, for instance, that's in line with my area of value, for instance, of mind, body health, I'm having to sort of get ready, travel, go to work. Instead of getting rid of those activities of personal value, what you want to do is to actually sort of slot them in at a different time. So it might be when I travel back from work, I go home, for instance, I travel straight back to the gym. Or it might be on Sunday or Saturday, I have extra hours at the gym, right? And then what would also be useful is to actually sort of slot in some time in which you're taking those extra sort of precautionary measures. So it might be, after work on Wednesday, if I'm working in a high-risk area such as a hospital, I'm taking the time out to shower, I'm taking the time out to actually sort of change my clothes, right? And then make this transition plan sort of clear to your household, to your family, to your spouse, to your flatmates, in the same way that you would make these adjustments sort of clear to, in the same way that you would have made the adjustments sort of clear when you're transitioning sort of back to like from work to home, you'd make those adjustments sort of clear when you're doing the other way around. So you discuss those plans, for instance. You would perhaps make it as collaborative as possible with your family, in order to minimize that additional sort of stress and to make sure that there's sharing of resources and responsibility. If you have kids, make the routine as predictable as possible and make sure that everything is well anticipated. That's one technique that you can try to sort of reduce that burnout that you might experience, in order to increase the resilience. So you're increasing resilience in order to reduce that burnout that you might experience in the current evolving situation of transitioning, so from home back into work. What's the next thing that you can actually sort of do? So the other way that you might try and buffer against the burnout within the context of having to deal with change, or within the context of switching from work to home, is to learn more about self-determination theory. Now, why is self-determination theory important? Because it's a theory that talks about motivation. Now, why are we talking about motivation? Remember, in the earlier definition of burnout, we said that when we're burnt out, we might start to feel a reduction in motivation. But what we want to do is actually sort of look at ways of keeping our motivation up in order to mitigate against the burnout. So what does the theory state? So the theory states that there are three components, to motivation. There's autonomy, competence, and relatedness. And what I'm going to do is I'm going to briefly talk about the three in terms of their definitions, and then we'll talk about strategies that we can implement to actually keep each of these balloons inflated, right? To keep our motivation up. Now, we want at least two of these balloons out of the three inflated at any one time to mitigate against the burnout. So what's autonomy? So autonomy is very much to do with this sense of self-direction, this sense of self-control. Now, within the current COVID crisis, we may feel like we've got a reduced sense of autonomy within our lives. So it might be, say, for instance, oh my God, I've got to wear those masks again in shopping malls, limiting our household to 20 people again. What if businesses sort of get affected? I've got to wear this mask that I don't want to wear, for instance. I had plans pre-Easter that got canned. So it's common to sort of start to feel like there's a reduced sort of sense of autonomy and self-direction within the current sort of context. Then we've got competence. Competence very much relates to this sense of skill and capability that you can actually sort of persist through this and continuously adapt and be flexible to this evolving situation. So a lack of competence might sort of feel like, I don't feel capable anymore. I'm over this. I'm so tired. I don't have energy or motivation. Can't stand this anymore. It's getting harder and harder to get out of bed every morning. I've had it. There's so much anxiety around working from the office. I've spent the entire year being cautious. Now they want me to move back, right? So that's pertaining to the sense of a lack of competence. And then we've got relatedness. So relatedness is very much about this sense of connectedness and belongingness to others. And it's important to feel that sense of belongingness, because when that suffers, that's when you can start to feel like it's very difficult to get through the drudge of work. Alrighty, so how do we increase our sense of autonomy? So one of the ways to deal with stress about getting a disease like the coronavirus is to examine how health anxiety can actually make us overestimate our likelihood of actually getting COVID when transitioning back into work, and underestimate our ability to cope if we actually did get it. Now, if we listen to the health anxiety part of our brains, right, so you'd sort of ask yourself, what's the likelihood of me actually sort of getting this virus? So the health anxiety part of your thinking might say, oh God, it's so likely, it's 1 in 10, it's 1 in 100. The more moderated part of you might say, maybe 1 in 10,000, 1 in 100,000. And then the maybe more frivolous part of you might say, oh God, 1 in a million. Now, the beauty about challenging your thoughts and engaging in these thought reframes is that we're not moving or oscillating from one extreme to the other. We're not being so careless that we're not taking the necessary precautions, but we're also not being so overly anxious that it's actually inhibiting our ability to function properly, and we're constantly sort of washing our hands. So how do we moderate our thoughts around this? We think about things statistically. So within the Australian context, what's the likelihood of actually sort of getting the virus? Look at the amount of people within the country that's actually gotten the virus. That's about 29,000 people. Put that over the current sort of Australian population, so that's about maybe 26 million individuals, and that will give you a statistic of 0.001. So that's actually the likelihood of you contracting the coronavirus. It's pretty small, right? So then think about, okay, so what's the likelihood of actually me getting a mild case? That's 4 in 5. Take that statistic and divide it by 5. That's about 0.0002 or so, something like that. The mathematicians in here will probably be able to do a better job than I am right now. So that's the chance of you actually sort of getting a mild case, right? And then the severe case, 1 in 25, that's the chance of getting a severe case. Take that number, 0.0002, and divide that by 25. And then that statistic that you get is actually sort of the chance of you getting a severe case. Then you'll look at the likelihood and the chance of actually you being able to cope within the situation if you were to contract the coronavirus. Ask yourself, do I have these protective factors? Am I under the age of 75? Do I have colleagues that can actually, and managers that I can actually sort of talk to that can provide me support around this situation? Do I have family and friends that can look after me if I was to get sick? Am I generally healthy? Do I not have any pre-existing health conditions, for instance? So am I generally sort of considered to be healthy? If that's the case, then your chance of actually contracting, coping and surviving and coping well afterwards is 99%. The chance of full recovery is 99%. If you're under the age of 50 or 60, the chance of full recovery is is at approximately 99%, right? So that's a good way, thinking about things statistically, to actually moderate that level of sense of control that you have, to increase that sense of autonomy that you have in this situation, to get that those motivation levels up. Then what you want to do is write down any unhelpful negative thoughts that you have about the virus. So, oh God, if I catch the virus going to work, then I'm going to spread it to everybody else, and my parents are going to get sick, my sick parents will get the virus. Then think about it statistically. And then also tell yourself, okay, so there's a 19 to 95% effective vaccine that's available. There's a Pfizer, AstraZeneca. If I was to contract the virus, it reduces my likelihood of actually sort of spreading it to others, even if I was vaccinated. Okay, AstraZeneca is not available to the under 50s at the moment, but hey, it even with the sort of blood clots associated with that, the chances are 20 in a million. So just thinking about it from that sort of particular sort of perspective, the chance of so getting sick is less than the chance of actually being smoking or being on the birth control pill in terms of the negative side effects of AstraZeneca. So just think about things in terms of your level of control. So from that sort of thought reframe kind of perspective. Okay. Now, the next sort of balloon that we want to very much be inflating is that of our sense of competence. So when our competence is down, that's when we can sort of also start to feel demotivated. So one way of really sort of thinking about the fact that we are capable of increasing our sense of morale within this evolving sort of situation is to think about our competence from a growth mindset perspective. Now, this has very much been spearheaded by researchers such as the like of Carol Dweck. And what she found is that new research has indicated that our brains are a lot more sort of plastic. So in older times, she indicated that it was thought that we had a fixed set of adaptability, a fixed set of flexibility, a fixed set of being able to sort of develop skills and take on skills. So old research thought that the brain was fixed and we had a fixed amount of intelligence, a fixed amount of ability to be adaptive and flexible. But recent research or later research has basically shown that no, the brain is actually plastic. That when we enter into the domain of a skill that is difficult, doing that dance of working from home and from the office, or challenging our thoughts and reframing the way that we think about the current sort of situation. Okay, so when we sort of push ourselves to be more adaptable and flexible with the current evolving sort of situation, when we do what is hard, what is difficult, what is challenging, when we enter that domain, what we're doing is we're actually facilitating the development. What we're doing is actually sort of, my video is no longer showing, I'm not sure what's happened there, but what we're doing is we're actually sort of facilitating the development of neural sort of connections. Hopefully everybody can see me now. So as I was saying, when we enter the domain of what is hard and difficult, our brain is responding by developing new neural connections, essentially. And so over time, it may seem that feel like that it's hard and difficult to do the task, but over time, it actually sort of becomes a lot easier because our brain is responding neurologically. So the skill becomes instantiated neurologically, and that's a powerful mindset to have when thinking our ability to adapt and to actually sort of be flexible. All right. What's the next thing that we want to talk about? Relatedness. So for a lot of people, going back to work, woohoo, more freedom, more flexibility. A long time coming, for instance. exciting, get to chit chat with my friends again or my colleagues at work, which basically means that, this drudge kind of work, all of a sudden I'm feeling a lot more motivated because I'm connected with other people, and that's going to allow me to get through the drudge of work. But for others, they may not have that sort of positive perspective. For others, it may be, God, I have to get back to work, I have to manage the commute again, I've got to navigate care again for my kids, longer days, I'm going to be tired. And so that's going to be the focus of their struggles. So in order to facilitate a sense of workplace belonging, as a colleague, you're in a good position to recognize when things are difficult with other colleagues. So what do? It's a good idea to sort of lend out sort of some support or encouragement to people that you find that are struggling. They're a lot more irritable, for instance, that are, finding it more difficult to concentrate. They're preoccupied, for instance, or frustrated. So, hey, I noticed that, you're looking a bit down these days. Do you sort of need any sort of support? I know things are a bit difficult at the moment. Or offering or suggesting that they speak to their manager, say, for instance, to sort of get some extra sort of workplace support or seek some sort of professional support during this sort of stressful time. Also important when you're working from home to recognize to continue to maintain contact with your workplace. So if there are catch-up Zoom meetings, by all means attend them. Maintaining contacts with others through apps, for instance, or through your phone or through email, whatever it is, because it's that contact that helps you actually sort of get through things that might be a bit difficult to sort of stomach if you don't really like working at home and you're finding that demotivating. Also, if you dread sort of going back into work, don't let the COVID-19 sort of phenomenon to dominate your workplace interactions. So for some people, it's okay. They may feel like, oh God, I really need to be discussing the effects and the implications at length with others. I need to get that sort of social sort of support and I need to debrief. And that's fine, but you may feel like that's reducing that sense of balance and workplace morale. But if you find that you're finding COVID-19 exhausting to discuss, dominating the conversation, let others know, just politely sort of just exit the conversation, re-enter when things are just a lot more moderated. And then also just recognize that other people are going to have different levels of anxiety around COVID-19. So just be mindful of that and respectful of those individual differences, as you all know. And then also I think it's important to remember that just be kind and compassionate to yourself when you are noticing that you've got high levels of anxiety sort of compared to others. Just recognizing that, accepting that others might be feeling different, and just respecting those differences of opinion, but being assertive in communicating your own needs and preferences and concerns, but just being open to hearing others' preferences and concerns as well. So hopefully that could help create a greater sense of affiliation and connectedness within the workplace, in order to facilitate that level of motivation in order to actually eventually reduce that kind of burnout. So thinking about things in terms of self-determination theory is quite important, and that's the second technique that I provided here in terms of dealing with the evolving situation. There's one more technique. So what's the third technique? It's problem solving. Now, what's the beauty associated with problem solving? A lot of the times when we're anxious, we're stressed, we're worried, we feel like that rumination and brooding is actually facilitating the problem-solving process, at least on an unconscious level. But it's not. All it's doing is that it's actually extending our emotional distress. It's not problem-solving. So what does problem-solving actually look like? Problem-solving involves writing down the problem on a piece of paper. It's getting what's in here and putting it down on a piece of paper, and then generating solutions to those problems, and then acting and implementing those solutions. So let's look at least one example. So it might be, oh God, I've got a chronic health condition. I live with someone who does. I'm caring for someone who's more vulnerable to COVID-19 than I am. And understandably, I'm going to be sort of anxious and really cautious about having to go back to work. What do I do? Okay. Then you generate the solutions to that. Okay, so I could seek medical advice from my doctors, for instance, to look at what's safe for me and what's optimal in terms of my safety and others around me. I can discuss any workplace modifications or flexible working arrangements with my boss. I can review sort of guidelines in particular sort of meetings. I can identify boundaries and anything that I'm unwilling to do and discuss this with my workplace. If I need to take extra precautions, for instance, what I can do is practice how I'm going to actually communicate those extra precautions in a way that feels comfortable with me. So, for instance, if I don't want to be taking those extra hour, like going on for those social gatherings after work, for instance, or declining after work social gatherings, I know how to articulate that in a way that's comfortable for me. Now, these conversations can be difficult, and they can make us feel vulnerable in disclosing that personal information. But at the same time, raising awareness will put our managers and our colleagues in a better position to actually sort of provide us with the appropriate support and identify a workable and safe plan for us. I provided a second example of how, a second example of a problem that might come up for us within this context of COVID-19 and a worry that might come up for us, and how to generate solutions for that, as well as some other concerns. So I think it's going to be really good if people sort of had to go at this particular task on their own. So feel free to define a problem and pop that in within the chat, a problem within the context of COVID. I'll give you about 45 seconds to do this, and then generate some solutions to the actual sort of problem. I might have a go as well. So one problem that I've identified here, I'm still anxious about everything. So feel free to pop this in the chat or just write it down. And then one solution to that is I can access EAP and other psych services to moderate my anxiety. Okay. Great, thanks, Maxime. How to maintain work efficiency when working from home. Yep. And then generating solutions to that, such as the strict sort of schedule, for instance, or making sure that you're not letting work-related things intervene with your home stuff. So you might be even getting those work-related apps off your phone onto your computers. There is that limit of distraction, and there isn't that crossing over and that overflow. Alrighty. So these are some other resources that can facilitate in the problem-solving sort of process. And we can also access Uprises and EAP for that extra sort of support as well. So remember, burnout can be addressed by increasing resilience, increasing motivation through cognitive challenging, as well as problem solving.